Welcome back to Dr. Gilbert, Healthy Aging. I am Dr. Gilbert. Throughout my decades as a vascular and general surgeon, I have looked inside the arteries and veins of thousands of human beings. I have held the delicate microsurgical instruments that restore vital blood supply to dying necrotic tissues, and I have seen firsthand the tragic, irreversible consequences that occur when the human body's complex transport network begins to fail. Today, we are going to dive deep into a very specific, deeply uncomfortable, and terrifying physical sensation that millions of you over the age of 70 experience every single day, yet often brush aside as just a normal, unalterable consequence of growing old. Let us sit down and discuss a heavy reality that many aging adults face in absolute silence, locked away in a room of persistent physical anxiety. Have you noticed that your feet feel completely and constantly cold, even when you are wrapped in a heavy winter blanket, or when the ambient temperature inside your living room is perfectly warm and mild? Do you experience a strange, heavy, dead numbness, or perhaps a restless, agonizing pins and needles tingling sensation in your calves and ankles when you sit in your favorite armchair or watch television for more than 30 minutes? Or maybe, when you attempt to walk just a short distance down your driveway to check the morning mail, you feel a tight, gripping, suffocating cramp in your legs that literally forces you to stop dead in your tracks, catch your breath, and wait in agony for the pain to subside? If you answered yes to any of these common symptoms, please listen to my voice very carefully today. You are not just experiencing the natural, benign slowdown of the aging process. Your body is waving a vivid, urgent red flag. It is desperately trying to warn you about a silent, progressive, and highly dangerous underlying cardiovascular disease: poor leg circulation. In my clinical medical practice, I see people make the fatal mistake of treating poor leg circulation as a minor inconvenience, an annoyance to be managed by wearing thicker woolen socks, purchasing heating pads, or rubbing cosmetic creams onto their skin. But as a surgeon, it is my duty to share the harsh, unfiltered clinical reality with you today. Ignored vascular health in your lower extremities is a rapid, catastrophic downward spiral. When oxygenated blood cannot flow freely to your lower limbs, your muscles, your peripheral nerves, and your skin cells are systematically and ruthlessly starved of the vital oxygen and essential micronutrients they require to survive. Left unaddressed over months and years, this localized tissue starvation leads to chronic, debilitating pain, severe muscle wasting, dangerous deep vein blood clots that can travel to your lungs, and non-healing ischemic skin ulcers that can rapidly become infected, permanently destroying your mobility and ultimately stripping away your independent identity forever. But I did not create this comprehensive, ultra-deep dive masterclass to leave you sitting in a state of helpless fear. Fear is a paralyzing emotion that serves absolutely no purpose in your long-term healing journey. I am here today to provide you with an extraordinary, life-saving, and scientifically proven mechanical solution. In this episode, I am going to reveal one remarkably simple, highly concentrated, and surgeon-approved vascular exercise that you can perform right from the comfort of your favorite living room armchair. This specialized movement requires absolutely no expensive gym memberships, no specialized exercise equipment, and no costly, time-consuming physical therapy sessions. It takes just a few short minutes of your time each day. Yet, despite its extreme simplicity, this single movement possesses the unique physiological power to completely flush your lower limbs with fresh, oxygen-rich blood, safely dissolve stubborn nerve numbness, expand your vascular pathways, and restore the vibrant physical freedom and mobility that you deserve. If you are truly ready to reclaim your independence, protect your complex vascular architecture, and walk through this world completely free of pain, I want you to eliminate all background noise and distractions right now. Focus your mind, adjust your speakers, and let us absorb this knowledge together. This will be the most important hour you spend on your longevity this year. Before we break down the elegant anatomical engineering of your body's circulatory system, take a brief moment to click that subscribe button and turn on the notification bell. By doing so, you ensure that you are always equipped with the real, unfiltered clinical truths needed to live a long, strong, and completely autonomous life. Now, let us uncover exactly what is happening inside the deep pathways of your legs. To fully appreciate and understand why this single exercise is so profoundly effective at reversing vascular decline, you must first look at your lower limbs through the eyes of a vascular surgeon. You must understand the fluid dynamics and the biological plumbing that keeps you alive. Think of your circulatory system as a vast, continuous, and highly sophisticated network of high-speed highways, local streets, and tiny alleys. Your heart is the central power station, pumping fresh, bright red, oxygenated blood down through your thick, elastic arteries, all the way to the tips of your toes. This downward journey is relatively simple and efficient because gravity works in your favor, naturally pulling the heavy fluid down into your lower limbs. The real anatomical miracle and the real mechanical challenge begins on the journey back up. Your body has to lift that used, dark, deoxygenated blood and cellular waste fluids all the way from your tiptoes back up to your chest, fighting against the relentless, crushing pull of gravity every single inch of the way, 24 hours a day. How does your body accomplish this incredible mechanical feat without possessing a second mechanical heart located inside your feet? It relies entirely on a brilliant biological design known in vascular medicine as the calf muscle pump, or what we clinically refer to as your peripheral heart. Deep within your lower legs, embedded densely inside your muscle tissues, runs a network of large, highly flexible veins. Inside these deep veins are thousands of microscopic, fragile, one-way crescent-shaped valves. When you walk, step, or actively flex your lower legs, your massive calf muscles contract with immense force. This squeezing action acts exactly like a mechanical hydraulic pump. It compresses the flexible walls of the deep veins, skyrocketing the trapped blood upward and forcing the tiny one-way valves open. The exact microsecond your calf muscle relaxes, gravity tries to pull that heavy column of blood back down into your ankles. But the tiny one-way valves instantly snap shut, trapping the blood in place and preventing it from flowing backward. With the next step you take, the muscle contracts again, pushing the blood up to the next level, like a boat moving through a series of locks on a canal, until it safely reaches your heart. However, as we pass the major biological milestone of age 70, two progressive, destructive structural problems combine to completely sabotage this beautiful circulatory system. 1. Peripheral Artery Disease, PAD, and atherosclerosis. Over 7 or 8 decades of life, small amounts of cholesterol, circulating fats, calcium, and fibrous tissue form a hard, calcified substance called plaque inside the delicate endothelial lining of your arteries. This plaque buildup systematically narrows the arterial highway. Instead of a wide-open pipe supplying a torrent of fresh blood to your leg muscles, the blood is forced to squeeze through a tiny, restricted, clogged straw. When you try to walk or exercise, your leg muscles demand a massive surge of oxygen. But because the artery is narrow, the oxygen cannot arrive. Your muscles immediately experience acute ischemia, oxygen starvation, which is exactly what causes that tight, crushing, suffocating cramp that forces you to sit down. 2. Venous insufficiency and valve failure. This is the failure of the return journey. Over decades of life, due to gravity, genetic weakness, or prolonged periods of sitting still, those microscopic one-way valves inside your deep veins become stretched out, scarred, and weak. Instead of snapping shut perfectly, they remain partially open and leaky. Because of this structural failure, gravity wins the war. The used, dark blood and metabolic waste fluids leak backward, flowing down into your lower legs, ankles, and feet. This is the absolute root cause of swollen, puffy ankles at the end of the day. Ugly varicose veins, that heavy, lead-like sensation that makes your legs feel like weights, and those agonizing, screaming nighttime calf cramps that wake you up gasping for air in the middle of the night. Now, I want you to think about what happens to your body mechanically when you sit in a comfortable recliner, a soft sofa, or a car seat for 3, 4, or 5 hours a day reading or watching television. Your peripheral heart, your calf muscle, is completely turned off. It is completely stagnant and flaccid. Because there is zero muscular squeezing action taking place, the blood in your lower legs moves like thick, freezing cold molasses. It sits there, building up massive hydrostatic pressure inside your ankles. Fluid leaks out of the veins into your surrounding skin tissues. Your peripheral nerves are severely starved of fresh oxygen, and a heavy, dead numbness or tingling sets in. In my surgical career, I have spent hours under the hot operating room lights, performing delicate femoral popliteal bypass surgeries, using synthetic tubes or harvested veins to stitch new pathways into legs that were suffering from advanced vascular starvation. It is a necessary, life-saving measure when things have gone too far. But what if I told you that in many cases, before the cellular damage becomes permanent and necrosis sets in, you hold the ultimate key to turning your peripheral heart back on? You do not need a scalpel to jumpstart your circulation. You do not need to alter your anatomy surgically. You simply need to know how to activate the natural hydraulic pump that nature already built inside your lower limbs. Let us now enter the practical heart of today's masterclass. I am going to teach you how to execute the single most effective, medically engineered vascular exercise for adults over the age of 70. This protocol is designed to maximize the volume and velocity of your calf muscle pump while putting absolutely zero impact, zero mechanical pressure, and zero strain on your joints. I call this clinical method the seated triple-action vascular flush. When seniors notice their lower body circulation is failing, the most common piece of generic advice they receive from well-meaning family members or basic fitness articles is, "You just need to get out of the house and go for a long walk." But as a vascular surgeon, I know that if you are over 70 and suffering from narrowed, plaque-lined arteries, walking can be a source of intense physical torment. Your muscles lack the necessary oxygen to sustain walking, so you experience pain, you become discouraged, you stop walking entirely, and your circulation becomes worse. It is a cruel paradox. This seated routine is brilliant because it completely removes your body weight from the mechanical equation. Your knees, your hips, and your fragile lower back vertebrae are completely unloaded and protected. This allows your central nervous system to safely force your vascular pump to work at maximum capacity without triggering joint pain or muscle ischemia. Let us perform this therapeutic routine together right now. Slide to the middle edge of a sturdy, supportive chair that has no wheels. Keep your spine long. Relax your shoulders. Place both of your feet completely flat on the floor about hip-width apart, and follow me through these 3 precise consecutive phases. Phase 1, the high-pressure heel lifts, vein compression. For the first phase of our vascular flush, we are going to target the primary high-pressure chamber of your peripheral heart, the gastrocnemius and soleus muscle complex in your calf. How to execute this phase perfectly? Keep the balls of both feet and all 10 of your toes firmly, completely glued to the floor. They must not shift or lift throughout this phase. Inhale deeply through your nose for 3 seconds, letting your abdomen fill with air. As you begin to slowly exhale through your mouth, lift both of your heels as high into the air as they can possibly go. Do not just lift them halfway. Push your ankles forward until you are standing completely on your tiptoes while seated. At the very peak of this movement, when your heels cannot go a single millimeter higher, goggle and squeeze your calf muscles with maximum intention. Hold this peak contraction for 2 full seconds. You should feel a firm, tight, almost burning squeeze in the back of your lower leg. Slowly, smoothly, lower your heels back down over a 3-second count until they touch the floor. Do not let them drop heavily due to gravity. You must control the descent to force the muscles to work eccentrically. The clinical dosage. We are going to perform 25 continuous, uninterrupted repetitions of these high-pressure heel lifts. The surgeon's insight. Every single time your heels reach that peak height and you squeeze that muscle tissue, imagine your calf muscles acting like two powerful hydraulic clamps, compressing your deep veins. You are physically reducing the volume of those veins to zero, rocketing that stagnant, dark, waste-filled blood out of your ankles and sending it flying upward through the leaky valves straight back to your torso. Phase 2. The anterior shin taps, arterial vacuum. The moment you complete your 25th heel lift, we must immediately switch to the secondary vascular chamber located on the front of your leg. This movement targets the anterior tibialis muscle, which runs parallel to your shin bone. How to execute this phase perfectly. This time, anchor both of your heels firmly, deeply into the floor. Imagine they are cast in concrete. They must not leave the ground. Inhale deeply. As you slowly exhale, pull your toes, the balls of your feet, and the front of your shoes as high as they can go toward the ceiling. Lift them up until your ankle joint is fully bent. At the peak of this lift, you will feel a distinct, tight contraction and a hardening of the muscles along your shins. Hold this position for 2 seconds. Slowly, with control, lower the front of your feet back down until they tap flatly against the floor. The clinical dosage. Perform 25 rapid but highly controlled repetitions of these anterior shin taps. The surgeon's insight. Why is this phase non-negotiable? In vascular anatomy, blood vessels form an intricate looping circuit. When you flex the front of your shins, you are creating a localized hydraulic vacuum effect. While Phase 1 pushes used blood out through the veins, Phase 2 actively pulls fresh arterial blood down through the smaller, microscopic vascular pathways of your lower leg. This expands your capillary network, bringing warmth and fresh oxygen directly to the dying nerve endings that cause that frozen, numb, dead sensation in your feet. Phase 3. The decompression ankle circles, gateway opening. To complete the triple-action vascular flush, we must open up the physical, structural gateway where major blood vessels cross over from your leg into your foot. This is the ankle joint capsule, which is often severely compressed, stiff, and arthritic in seniors over 70. How to execute this phase perfectly. While remaining seated tall in your chair, extend your right leg slightly out in front of you. You do not need to hold it perfectly straight or high. Just lift your foot 3 or 4 inches so it hovers safely above the floor. Now, begin to rotate your ankle joint in a slow, wide, deeply deliberate circle. Imagine you are drawing the largest circle possible in the air, using your big toe as a pointer. Move through every single angle of the joint. Do not move fast. Fast movement skips the tight corners. Slow and smooth is the secret. Rotate clockwise 12 times, then immediately reverse the direction and rotate counterclockwise 12 times. Lower your right leg completely, lift your left leg, and repeat the exact same sequence of 12 circles in each direction. The clinical dosage, 12 circles in each direction for both legs. The surgeon's insight. As we grow older, osteoarthritis and lack of movement cause the heavy tendons and ligaments surrounding the ankle joint to become incredibly tight and rigid. These tight tissues physically squeeze the posterior tibial artery and the dorsalis pedis artery, the two primary pipelines supplying blood to your foot. By performing wide, slow ankle circles, you are decompressing that joint capsule, releasing the soft tissue tension, and opening the physical floodgates so blood can flow unimpeded all the way to your toes. Now that you have mastered the precise mechanical execution of the seated triple-action vascular flush, we must establish the precise medical dosage and scheduling protocol. Just like a prescription medication or a surgical therapy, an exercise only yields true clinical benefits if you take the correct dose at the exact right biological time. For maximum vascular results, I want you to perform this entire 3-phase routine 3 times every single day, without exception. The first dose, the morning activation. Perform this routine in the morning, right after you wake up, while you are sitting on the edge of your bed or eating breakfast. This wakes up your peripheral heart and immediately clears out the venous pooling and fluid stagnation that naturally accumulated in your legs while you slept overnight. The second dose, the afternoon break. Perform this routine in the afternoon, around 2 p.m. or 3 p.m., when you have been sitting for a prolonged period reading, resting, or digesting lunch. This breaks up sedentary stagnation and keeps your blood thin and moving. The third dose, the evening clearance. Perform this routine in the evening, about 30 minutes before you retire to bed. This flushes out the fluid accumulation from the day's sitting and prevents those agonizing nighttime vascular spasms and calf cramps. The entire 3-phase routine takes less than 4 minutes of your time. However, if your poor leg circulation is severe, if your feet are constantly frozen white or blue, or if you suffer from advanced diabetic neuropathy, I want you to employ a special behavioral habit that I teach to all my clinic patients. The TV commercial protocol. Whenever you are sitting down watching your favorite afternoon television program or the evening news, every single time the show cuts away to a commercial break, slide to the edge of your seat and do 1 round of this exercise. Instead of sitting completely motionless during those 3 or 4 minutes of advertisements, turn your calf muscles on. Flush your legs with blood. By the time your show ends, you will have completed 4 or 5 rounds of highly effective vascular physical therapy without ever feeling like you did an exhausting or sweaty workout. What should you expect to feel when you begin practicing this routine consistently? During the first 2 to 3 minutes of your very first session, you will likely feel a warm, rushing, slightly tingling sensation traveling down into your toes. Please do not be alarmed. This is a phenomenal medical sign. It is not a negative symptom. It is the feeling of hundreds of thousands of collapsed, dormant capillaries opening up and accepting fresh, warm blood flow. It is the literal feeling of your feet coming back to life. Within 2 to 3 weeks of daily, uninterrupted consistency, structural changes will manifest inside your tissues. My patients report a dramatic 80% reduction in nighttime calf cramps, a miniature reduction in ankle swelling at the end of the day, and a wonderful feeling of lightness when they stand up to walk. You are actively remodeling your blood vessels. As a surgeon, I must look at your health holistically. While the seated vascular flush is an incredibly powerful tool, its therapeutic benefits can be completely canceled out if you are unknowingly making these 3 common, daily lifestyle mistakes that actively destroy your vascular system after the age of 70. Mistakes #1. The habit of crossing your legs at the knees. Many of us cross our legs at the knees or at the ankles habitually whenever we sit down to read or talk. When you cross one leg over the other, you are creating a profound, heavy physical compression directly against the popliteal artery and the large, deep veins located right behind your knee joint. From a mechanical perspective, it is exactly like putting a sharp, tight kink in a plastic garden hose while the water is running at full pressure. Your peripheral heart has to pump against a physical wall. This forces blood to pool in your lower calf, worsening varicose veins and increasing fluid leakage into your ankles. My strict advice: train yourself to sit with both feet placed flat on the floor, hip-width apart. Keep your internal highways wide open and unrestricted. Mistake #2, wearing restrictive socks with harsh elastic bands. Look at your legs tonight when you take off your socks before bed. Do you see a deep red indented ring pressed into the skin of your calf or ankle? If so, your socks are acting as a daily mechanical tourniquet. Regular socks often feature tight, cheap elastic bands designed to keep them from sliding down your leg. But at age 70, that tight ring physically blocks the gentle, low-pressure venous blood from returning upward, trapping dark fluid at your ankles all day long. It starves the surrounding skin cells of fresh circulation, leading to thin, fragile, shiny skin that breaks open easily. My advice: immediately throw away restrictive socks and invest in specialized non-binding socks or wide-top senior comfort socks. They stay up without squeezing your tissues. Mistake #3, living in a state of chronic dehydration. As we pass the age of 70, our brain's natural thirst mechanism becomes significantly less sensitive. You might go an entire day without ever feeling thirsty, but that does not mean your body doesn't need water. When you live in a state of mild, chronic dehydration, your overall blood volume drops, and your blood physically becomes thicker, stickier, and more viscous. Thick blood moves incredibly slowly through narrowed, plaque-lined arteries, making poor circulation significantly worse and drastically increasing your risk of forming a dangerous blood clot inside your deep leg veins. My advice: do not wait until you feel thirsty to drink. Sip water consistently throughout the day. Aim for 6 to 8 glasses of pure water daily, unless your cardiologist has placed you on a fluid restriction for a heart condition. To accelerate your vascular recovery and completely revitalize the veins and arteries in your lower body, I want to share 3 bonus daily habits that complement your seated exercise perfectly. These are the exact strategies I give to patients recovering from major vascular interventions. The gravitational drain, leg elevation. Every single afternoon or evening, dedicate 15 minutes to elevating your legs. Lie down flat on your sofa or your bed and prop your legs up on 2 or 3 comfortable bed pillows. The key clinical rule here is to ensure that your ankles are elevated slightly above the level of your heart. When you do this, you turn gravity from an enemy into an ally. Gravity will effortlessly drain the pooled, stagnant fluid and dark blood out of your lower legs, relieving ankle swelling and that heavy, aching, tire-like feeling instantly. It empties the venous system, making room for fresh, arterial blood to flood in the moment you stand up. The contrast warm soak. Before you retire to bed, consider soaking your feet in a basin of warm water for 10 minutes. Please ensure the water is comfortably warm, never hot, as older skin can be highly sensitive and prone to thermal injury. Warmth triggers a vascular reflex known as vasodilation. It tells the smooth muscles inside your artery walls to relax and widen. This draws a massive wave of warm blood to the surface of your skin, eliminating icy feet and preventing nighttime vascular spasms. The upward lymphatic massage. If you use a moisturizing lotion on your legs to combat dry skin, turn that routine into a circulation treatment. When applying lotion, always massage your legs using firm, smooth strokes that move upward from your ankles toward your knees. Never rub downward. Upward strokes manually assist your veins, guiding the trapped blood back toward your pelvic cavity, directly supporting your peripheral heart. My dear friends, as we draw this comprehensive vascular masterclass to a close, I want to speak directly to your heart. Reaching your 70s, 80s, or 90s is an incredible, sacred milestone. It is a season of life that should be defined by your freedom, your wisdom, and your joy, not by limitation, constant pain, and a shrinking circle of activity. Your legs are not designed to fail you as you age. They are designed to carry you forward, to keep you independent, and to protect your freedom. By adopting this simple, mindful, seated triple-action vascular flush into your daily rhythm, you are doing far more than just moving muscles. You are rewriting your biological script. You are choosing vitality over decay. You are choosing to keep your freedom, your mobility, and your autonomy. Do not wait until tomorrow morning to start. Stand up, or rather, sit back in your chair right now, look at your feet, and perform your very first round of high-pressure heel lifts and toe taps as soon as this masterclass concludes. Your legs will thank you for it. If you found today's episode deeply valuable, please share it with your spouse, your neighbors, your friends at the senior center, or anyone you know who struggles with leg pain, swelling, or cold feet. Let us spread the gift of practical vascular health together. Thank you so much for welcoming me into your home today. Remember to click that subscribe button to join our family, keep your peripheral heart pumping, protect your circulation, and I will see you in our very next episode. Stay strong, keep your blood flowing, and walk with absolute, unshakable confidence.